So I can begin? Yes. Okay. My name is Choolwe Haamujompa. I work for the International HIV AIDS Alliance in Zambia. And basically through the work that I've been associated with, we try to promote community-led responses that can positively impact on the lives of people living with and affected by HIV. And I think over the past years, we've seen commendable strides in relation to improving the welfare of people living with HIV. I say this through a lot of support we've gotten from the Global Fund. And through the Global Fund, we've seen, for instance, a number of community health workers' capacity being built, such as treatment support workers, also treatment support mobilizers. All these community volunteers have definitely helped to improve adherence amongst people living with HIV. And really, the key thing is to prolong people's lives and ensure that everyone who is HIV infected, when they're eligible, they're put on treatment. So it's support from a number of cooperating partners. Alliance Zambia has been involved actively in engaging communities to improve community responses that relate to HIV. And in instance, through the work and my interaction with the communities and people living with HIV, it's quite notable that we have made notable gains in terms of containing the HIV epidemic. And I think as a country, we definitely appreciate the funds that Global Fund has channeled, at a country level, because I think most of these funds have trickled down to people living with HIV. And at the end of the day, we have a significant number of people who are living positively. So I think there is testimony to that effect. So I think they still need to continue supporting various HIV/AIDS interventions. I think we are now reaching at a point where we're saying we need to invest more so that we can preserve people's lives. And in addition, I think there's been impact that we can see because quite a number of people have been put on ART. The provision of ART has been mostly been supported by donors, one of them being Global Fund, being the major channels of support to the country national response on HIV, TB, and malaria. So I'd say we have no alternative but to still continue to appreciate and still continue to advocate that there is actually increased funding for these three disease burdens, particularly HIV, TB, and malaria, because I think there's an interconnection between the three disease burdens. And I would like to urge really all cooperating partners, the donors, to still step up the fight against HIV. I think there are a lot of dynamics involved. I think supporting HIV interventions in the long-term goal will also help eradicate poverty. So there's still a very strong correlation between HIV and poverty. And the more productive sector of people we have healthy, it means there's no production in the country. It also entails that the economy will also improve based on a strong and productive workforce. So we definitely need everyone to live a long, healthy life so that they contribute positively to the economy, but also to ensure that even at a household level, people can have sustained access to food, housing, shelter. and health in this context is very, very paramount. So we would like to see really improved strides at improving access. And access here, we're talking of access to medicines, availability, cheaper cost of drugs. I think that's basically the context in which most of these drugs should be provided. But we also want to see an integrated approach where HIV, TB, and malaria national response is scaled up to ensure that at some point we actually come to a situation where HIV, AIDS comes to an end. So I think the key advocacy thing is really we want to see a fully funded global fund, which is functional, effective, and which responds to each country specifications, unique specifications in terms of the disease burden, in terms of the poverty levels, and also in terms of the various characteristics that are prone, that make most of these populations more vulnerable to HIV infection. So it's very key that we have a fully funded global fund, so that each and everyone can have equitable access to treatment. Thank you.